Hello, this is Hillary. Welcome to Pelvic Health Essentials Week 6. So this is our last week, and I'm saving the best for last. This week is all about returning to intimacy, particularly in postpartum, but this could be in the context of after having surgery or after having not had sexual intercourse for a period of time due to pelvic floor issues or some other reason. So, in some just pelvic health perspectives on this topic, and also coming from personal experience and talking to lots of other professionals who work with postpartum women and getting some of their insights as well. So, I've brought together this lecture education session very much in a collaborative kind of way, and just from conversations I've had with other women's health professionals, perinatal health professionals, pelvic floor therapists. So some of the tips you're seeing in here don't originate from me, others of them do. My hope is that by the end of this session, so let's just dive into the next slide, that you'll kind of be more aware of common disruptors of intimacy and sex, particularly in postpartum. I'm going to give you my most common recommendations. These are from a pelvic floor therapy perspective, but then we're going to kind of shift and look more at intimacy rather than just sexual intercourse. And what role that can play in returning to sexual activity in postpartum. Because a lot of times we get very hyper focused on returning to sex in the context of the way you make babies, penetrative sex. And really, I think couples are better served by taking a broader perspective of intimacy and sex in postpartum. And by taking that broader perspective, there's a lot more opportunity for continuing to have that closeness and connection while putting less pressure on the mom or the birthing person for meeting certain expectations. And then I'm going to end, excuse me, with a bunch of tips for finding more opportunities for intimacy to help you as a mom, and providing tips that I think should be shared with a partner. And I should have mentioned this earlier, but this is a great session or a recording to share with your partner and have them watch or listen in on and learn a little bit themselves. So let's dive in. Okay, so we're going to start with the not so fun stuff. So pain with sex is called dyspareunia. And it's a challenging dyspareunia. And I always mispronounce it and I kind of just slur it, dyspareunia. And it is pain with sex. Excuse my fumbling there. But anyways, I wanted to provide some more recent statistics because as a pelvic floor therapist, I would say almost all of my clients have reports of some degree of discomfort or pain with sex. However, I can only think of a handful, not even a handful, who have come to me for services because of this symptom. This is something that comes up through us working together, but is not the initial reason the woman is seeking out pelvic floor therapy, which makes me wonder if this is a woman's only symptom postpartum. How many of them are never seeking care for this problem because they think it's normal, or they think that it will get better, or whatever they may be thinking. And I hope you come away with realizing that this is a very specific and very important symptom to attend to and to seek out care for having it improve. And some women, it can be really quick and easy with some pelvic floor therapy, and other women, it can take some time, but it's something that shouldn't be ignored, and we shouldn't be kicking the can down the road. We should be taking care of this earlier rather than later. So a 2020 study showed that 42% of women reported pain with sex, dyspareunia, in the first 2 months postpartum. 43%, so actually more, and that's likely the slight increase is because many women have not engaged in sexual activity in the first 2 months, so they may not know. Um, in 3 to 6 months postpartum, and 22% still have it 6 to 12 months postpartum, pain with sex. And then you wonder, okay, well, what about more than a year? There's certainly still percentages there. And another study from 2017 showed similar statistics, about 51% of women at 6 weeks, but not that much better at 6 months. So, what are we doing? Basically, the conclusions of both of these studies is that we need to research this issue, this problem more. We don't really know enough about it or what the drivers of it are. And I think another aspect of it, which they also recommend in these studies, is women need to be better supported through navigating the challenges of this symptom diagnosis. A lot of times, and this is in fact the advice I received after my first, and I said, everything feels a little different, it's not very comfortable. That it was just like, well, just wait, it will get better. And that's what I hear a lot of women receiving that advice. And in many cases, it will get better. But in a lot of cases, it won't. And this is a problem that needs to be attended to and researched better. All right. So, common drivers of dyspareunia in postpartum. So, this is from my practice and from the research, but perineal tears certainly. Talk a little bit more about that, which also lead to scarring. There also can be scarring from medical procedures. There can be old scarring that is leading to pain. There can also be C-section scars, and those can contribute to pain with intercourse. Even though it was not in the vaginal area, it's in the abdomen, it's connected. And that connective tissue can play into tightness, and tightness can play into having dyspareunia. So muscle tightness is certainly a driver in almost all the cases I've seen. Prolapse can cause pain with sex. Of course, things out of place, the sensation being different. Breastfeeding, fear of pain, just that fear of even trying it can drive pain or sensation of pain once intercourse is attempted. General stress and anxiety, time, and connection. So these are some more broader, more vague things, a little harder to study, but certainly are contributors to pain with sex and postpartum. So let's dive a little deeper into each of these. So perineal tearing, I haven't talked a whole lot about in this course. It is the most common birth injury. It's graded from stage 1 through 4, stage 1 being the least severe and quite common, and stage 4 being the most severe and fairly uncommon. Stage 1 is the skin only and usually does not require any sort of intervention and will usually heal just fine on its own. Stage 2 is skin and some muscle, and most stage 2s need a few stitches, but they're usually done right then and there in the delivery room. Stage 3 is skin, muscle, and some of the anal sphincter. Either the external or internal anal sphincter has some involvement, and this needs a more higher surgical repair. It is not always repaired in the delivery room, although that sometimes it is. Stage 4 is skin, muscle, and all of the internal and external anal sphincters. So quite a severe tearing at stage 3 and stage 4 that require surgical intervention to repair. So 90% of first births result in a stage 1 tear. And these are like little superficial cuts, kind of like a paper cut, just the skin, nothing real deep, but it can be uncomfortable and it will result in small scars in many women. Some women, maybe a scar might be almost negligible, depending on varying factors. And up to 75% of first births result in a stage 2 tear. So very common. The percentages go down with subsequent births. I think stage 2 is about 40% of second time births. Now, the stage 3 and 4 is less than 5% of births. So, quite uncommon. In fact, 5% is a high end estimate of that. Now, scarring, if you think about scarring, so if you have a tear, and certainly stage 2 and definitely stage 3 and 4, there's going to be scarring. It makes connective tissue and skin less flexible. There can be adhesions that develop and also scar tissue. Scar tissue is just firmer and stiffer and not as pliable, and it has less collagen. So it's going to make the tissue in a very important area less mobile. Also, with the C-section scar, yes, the scar is way up here, the vagina is way down here. How does that relate? Well, this goes layer deep to your uterus, and your uterus, as we all know, is connected to your vagina. So if you're having scarring deep down, adhesions, scar tissue can kind of spreads and grabs onto things and can make this whole area more stiff, less pliable, less flexible. If we go all the way back to week 1, we talked about a key element of optimal pelvic health is having strength and flexibility of the tissues. So this is where scarring can impact that. Scar tissue massage from early on can have a huge benefit on the flexibility of the skin near and around the scar. So any C-section mamas or perineal tears, I suggest starting scar tissue massage quite early, as soon as the wound is healed or closed, I should say. We should start, and we can start much earlier on in surrounding areas, especially with C-section, because there is a lot of surrounding area that's easily accessible. Whereas with perineal tears, sometimes you have to wait a little bit longer because it's in a much smaller area, and a lot of times women will need guidance on how to do the massage in those areas. Okay, so muscle tightness, prolapse, and sensation. All kind of intertwined things, not always prolapse, but certainly muscle tightness and sensation. So muscle tightness and prolapse change sensation. Muscle tightness changes sensation, prolapse changes sensation. And when we have a change in sensation in our vaginal area, our pelvic floor, what once felt good could now not feel good. It could feel burning, aching, radiating, or even sharp pain, or it could just feel different, and that different sensation causes stress, anxiety, or like, is something wrong? And I think it's really important for women to reach out if they're having those thoughts, like, is everything okay down there? Whether that be with their OBGYN or be through a pelvic floor therapist. So when I get the sense that a mom's feeling like, I don't know what's happening down there, I am always guiding them through with a mirror, with me, supported. Okay, here's your perineum, here's your vaginal opening, here's where you have pain. Let's try touching it. Okay, how does that feel? Now notice if you do, and I'm guiding them through what's going on in their pelvic floor, kind of reorienting them. So internal and external anatomy can shift. If we think about prolapse, it certainly is shifting through childbirth, resulting in the vulvar, or I should include it in perineal, in the vagina area, feeling just different. Just doesn't feel right, doesn't feel the same. I don't enjoy it as much because I don't understand these sensations. And that can be unsettling, and it can also reduce sexual arousal and drive, which is a big issue with postpartum women, is that arousal and desire for sexual activity. And we'll get into that in a little bit. Okay, so some other factors that I mentioned. So breastfeeding causes a menopausal-like state. Keeps estrogen low, so your prolactin can stay high, so you can produce milk. But that also lowers libido and lubrication. So you have a lower sex drive, and when you do engage in intercourse or sexual, or you're becoming sexually aroused, you're not going to have as good lubrication. As we all know, less lubrication does not feel as good, it's not as enjoyable, and the cycle goes from there. So, fear of pain, this is a big issue. So, some women expect or have kind of been conditioned through maybe what they've heard from friends or family members that postpartum sex will hurt, and there's no way to avoid it. So, they choose to more or less avoid it because they don't want it to hurt. Um, or they grit and bear it and say, like, oh, this is normal, like it's supposed to hurt. I just should do it anyways. But that really chips away at the pleasure. And I want to redirect that belief that postpartum sex should be painful. It's not always the same, but it should not be painful for really at all. And if it is painful, it should be improving dramatically with each attempt at sexual intercourse. So if you're in this category, I really encourage women to seek support from a pelvic floor therapist to see what is going on that's driving this discomfort. Why is this present? Why are you having to grit and bear it? Or why are you avoiding it? So there can be many factors here. Sometimes a sex therapist or counselor can be also very beneficial if it's a little bit more of a psychological thing rather than a physical thing. But you can rule out the physical aspects through seeing a pelvic floor therapist. Anxiety and stress. So becoming a mother, it's just stressful. It just is. And can cause anxiety in many women. So both of stress and anxiety reduce libido. You don't feel like having sex. It's harder for you to get aroused. And so therefore you're not engaging it and you're not returning to sexual activity you once had or at all. Time. So you're not returning to intimacy because you literally are like, when would there be time? And often this ties into the exhaustion factor, the fatigue. It's another luxury. It's hard to come by. And when you get a choice between sleep and sex, oftentimes you're choosing sleep because you're breastfeeding and you're exhausted and your libido is lower and you have low lubrication. It's going to take you a long time to get aroused. And you're like, I don't have time for that. I'm just going to go to bed. And this is the cycle that starts happening. But then that also can start to creep into the connection you have with your partner. All these factors coming together can really start making that sexual connection or that intimate connection you once had with your partner become a lot more challenging. So I think these factors are best explored. We're not suggesting that you stop breastfeeding or you just don't be afraid or just don't be stressed, because these are realities that you're dealing with and you can't just flip a switch. But support can go a long way in helping you progress towards that goal of being that sexual person that you are, and returning to it, and being open to it, maybe looking different than it did once before. Okay, so what was a woman to do? All these factors piling up against you, how the heck are you supposed to return to intimacy, and why should I even try? So let's talk about this. There's no one answer. These, however, are my top recommendations on consult calls. So when I get someone calling, maybe they're calling for urinary frequency, leaking, or some other issue, but then they also say, oh, like I tried returning to sex, but it's just really uncomfortable. So I'll throw out these few quick tips almost all the time. And my first one is always like lube, lube, and lube. Because postpartum women are dry down there, and especially if you're breastfeeding, and you need a good lubricant, and you may not have needed that before you were pregnant or when you were pregnant, but you do now, and it can really change the game in terms of your pleasure with it. Excuse the helicopters. Hopefully they're not running drills tonight, but I do live near the Marine Corps base. Okay, my next recommendation, and I love this, is what's called intimate touch. So this is, and I'll give a little more insight into it later on. I think I bring it up again, but it's you and your partner touching in a sensual way, but in non-easily aroused areas of each other's bodies. And so just massage can be considered intimate touch, but this is more literally for the purpose of just reconnecting each other's body and appreciating the sexual being that each of you are. And often I think it's good to set some boundaries or guidelines of what is okay and what is not okay, or just going with it and see where it takes you. It can be an enjoyable thing. Trying new positions and lots of them. So often couples may have only really engaged in sexual intercourse in a couple of positions or one position. And like I mentioned, anatomy can change, sensation can change, lubrication has probably changed, and the way certain positions feel really can change the sensation that the woman receives, making some positions much more painful while other positions are gloriously comfortable. So being open to trying new things is really important. So I have a blog post on this concept of a lover moon. So lots of you may have been on and done a baby moon where you kind of celebrate your last hurrah before baby arrives, similar to a honeymoon. And I propose that do the baby moon if you want. But if you have the luxury to get away in the first 12 to 16 weeks postpartum with just your lover, your partner, without baby, and it may just be for 24 hours, and maybe if you're lucky it could be 48 hours. I think this is really helpful for the reconnection of mom and dad, or mom and mom, or dad and whatever combination it might be. But I think it focuses, it takes mom out of that mom mode because baby's not there. Yes, if she's breastfeeding, she's going to have to still pump. And maybe if it's close by, someone's coming by to pick up that milk to bring it to baby. But it helps mom to reconnect to being a woman and not just being a mom. There's many roles that moms have, but they get very caught up in mom role. And it can be hard to be a sexual being and lover when you're wearing your mom hat. Mom hat is for mom stuff, and mom stuff isn't really sex. Mom stuff is caring and making sure safe and feeding, and we get stuck in that analytical head. So arousal is very challenging. So I think this concept of escaping for an overnight, a romantic, quick little getaway can be a great way to reconnect. I don't suggest doing this for your first time re-engaging in sexual activity. I think it should be done once you've established somewhat of a baseline. I think if it's the first time, you're like, 6 weeks, we're gonna have sex, yay! You could be putting a little too much pressure on it. So I think it's better reserved for more like that 12 to 16 week time frame. When you've already probably tried sexual intercourse a few times at least, and have established that there's no major issues, and it's just like a time coordination of schedules and fatigue and breastfeeding issue. Okay, and also working with me, calling a pelvic floor therapist to come help you out. Okay, so pelvic floor therapy for dyspareunia. What would we do? How would we help with that? Well, we do an evaluation to try to determine if it is sexual, physical in nature, or if there is some physical components, but also maybe some emotional components or environmental components. As an occupational therapist, I very much help with those components as well. Mental health components all play into a factor. But on the physical side, we're looking for areas of pain, both internally and externally, assessing for coordination, strength, and endurance. But very much, I think we're kind of pelvic floor therapists who are not looking at these other factors could be missing a lot. And so, yeah, maybe you do have pain, but it may also, there may be some other components that are driving that pain or contributing to that pain. So treatments may include manual release, teaching you scar tissue massage, relaxation training, so maybe just globally or specifically in the pelvic floor if your pelvic floor is very tight. Medical devices that may help improve sensation or relaxation. So loosening, releasing tightness. Sometimes there's lots of wands and tools and things that can help release and muscle tension on trigger points in hard to reach areas. Exercises to relax or strengthen the pelvic floor, and patient education. And this is where I'm always, anytime I give a woman who's having pain with sex home stuff to work on at home, I always suggest, like, hey, if you're up for it, get your partner involved with this. It can be a great partner intimacy activity, and it's going to help you progress towards enjoyable sexual activity. And I think it's a great way to start having more intimacy, even though you may not be having penetrative sex. All right, so sexual loops. I think it's really important for men and women to really better understand our sexual loops and how they're different. So if you look at this, second half is the same, first half is swapped. So women become aroused, then they go, okay, I'd like some sex. Then orgasm, then resolution. Whereas men are like, I want some sex. And then they become aroused. And then orgasm, resolution. So it's a different process. And men, if they're not aware of this, will assume, well, like, don't you just want sex? And women are like, nope, I don't feel like I do, because they're not aroused. Arousal comes first for women. And that's really important, I think, for both the male and the female in that relationship to understand. So men have frequent thoughts and desire for sex. Women, less frequent. Not that they never have thoughts about sex or wanting it, they certainly do, but they're just less frequent, and they're particularly less frequent in postpartum, I suspect. I don't think there's any firm research on that, but I suspect that that's the case. And I think I say that because biologically, our brains have shifted to focus on baby, as well as we're trying to maintain an internal external balance in our environment and our lives, and we're juggling a lot, and we're just trying to keep things balanced. So there's a lot to think about. So when opportunity arises for men, whether sought out or organic, arousal is easy because they've already I want sex, I want, and that's already happening in their brain. So then when the opportunity, you come over and kiss and hug and pinch his butt, and he's like, ooh, opportunity arise, maybe we can have sex. And you're just thinking no, I was just trying to be sweet. Because you're not aroused yet. You're just saying hi. It's all about opportunity for men. So if there's opportunity, chances are they had the desire at some point in that day. If they're healthy and functioning well, not very stressed. Of course, there's things that can go wrong with this for men. I'm not going into that here. But with women, it's less frequent that we're thinking about it. So for arousal to occur, which is the first step, women need balance or calm achieved, and then arousal is easier. Once aroused, desire ensues. You need to feel arousal first. There's many things in postpartum life that can just zap arousal and zap desire. So it's all about environment for women, their internal state as well as their external environment. So is it safe? Do I feel calm? Internally, is my to-do list settling down or is it still going? So it's hard to turn that off and shift to, ooh, I want to become aroused now. It needs to calm. And then you have the space emotionally for that arousal that leads to desire. Okay. So postpartum sex is about more than just sex. These are some other things that I think are really key to be explored and discussed and understood and used by partners. So intimacy, I'll get into that. Communication, trust, safety, patience, teamwork. It's not a one-sided thing. This is a mutual thing. So there needs to be teamwork. Okay, let me go into more detail. So 4 types of intimacy. Now there's many models of intimacy. This is one that I've used for years where there's these 4 elements. So intellectual is like the exchange of thoughts, ideas, perspectives, and you enjoy both the similarities and the differences of each other. You find each other intellectually stimulating, and that stimulation feels intimate to you. So an example is you watch a movie and then you debate on who was the best actor. Or you're sharing with your partner about your parenting philosophies. And maybe you don't see eye to eye with each other, but you listen to your similarities, your agreements, and your disagreements, and you talk constructively about it. Emotional intimacy is feeling safe with one another to share the good, the bad, and the ugly, with trust and confidence. So some postpartum examples of this is you feel safe enough to share your displeasure with your postpartum body. Like, oh my God, look at this jelly belly, look at this stomach, can you believe it? And you know by saying that, you're gonna get like a loving, supportive response. Or your partner feels safe enough to share how he feels uncomfortable when he holds the baby, knowing that you're not gonna be like, oh my God, and freak out, or unlikely to have that response, but rather being supportive and trusting and confident in the other person and what they're saying when they're being emotionally vulnerable to you. And that creates a high level of intimacy. So spiritual, this is respect for each other's beliefs. Often it involves having a shared purpose, you have shared visions, nurturing each other's inner peace, do things to help nurture that calm or that spirit within you. You do that for each other. So you might read lines of scripture together, or you might watch the sunset together, marveling in the beauty of your baby. Just doing these like things together that bring awe and inspire. And that creates a lot of intimacy. And then finally, experiential, I think is the one that most married couples or partners relate to. It's just so you do enjoyable things together. So going for a walk and it's just enjoyable. You're with your best friend. Collecting seashells. You guys love doing that together, or cooking a meal, or whatever it is that you do together. Those mutually enjoyed activities are great at building intimacy. So, homework is to write down 5 intimate activities or topics. So if it's intellectual, it would be like, I really would love to talk to my partner about his parenting philosophies, or where we see each other in 10 years, or it could be topics that are discussed, or it could be activities that you think will increase intimacy. You know what, we need to, so something my husband and I do is when it's a full moon, every time it's a full moon, we go for a walk at night. Just around the block, or sometimes we just sit outside, but we always try to set aside time on full moons to do something together and to admire the moon. So something like that. And these little rituals can add up and build intimacy and build opportunities for connection outside of that hustle and bustle of postpartum. Allowing for continued connection, even if you are not having that sexual connection at the moment. Okay, and have your partner do the same and then share what you have, and they don't have to be the same things. Okay, so intimacy conversation starters. So for mom, these are some things that I think are good for you to reflect on and then share. So you can use these questions really in whatever way you want. You might just go through them together, or you might reflect on them first and then share your answers, share what you came up with. So what helps you feel heard? What helps you feel calm? And what helps you feel safe? In my experience with helping moms who are struggling in postpartum with a variety of things, I think them having a sense that there's someone, and particularly that partner, that they're feeling like they're heard, no matter what they're saying, that someone's actually listening to them, really goes a long way in easing their stress and anxiety, which calms them and helps them feel more safe. Someone's listening. You feel like you're understood. When you feel understood, you feel calmer. And when you feel calmer, you feel safer. So that's why I have them in this order. These are really great things for you to reflect on as a mom, because these are things that are going to be challenged in ways that haven't been previously, potentially. I'm not saying it's impossible that they haven't been challenged, but I think in postpartum, for a lot of women, it's the first time they're really being challenged, because there's this other being that you are hardwired to protect and do everything in your power to care for. And partner isn't so much number one anymore, and that can be hard. So if partner can help you feel heard, calm, and safe, intimacy and likely sexual activity is going to ensue much more easily, because you're going to become aroused more easily. So continuing to go on, just what helps you feel ready for intimacy or sex? Is it like the house needs to be tidied up, or I need time to take a shower, or I need someone to wash the bottles, or I need someone to help me put down baby? I mean, I think a lot of times it's preparing the environment, which goes back to those arousal loops that mom needs. But whatever your answers come up, be curious, really kind of dig deep into what you would say for this. What types of intimacy do you most connect with? So that's that intellectual, experiential, emotional, or spiritual, and exploring ways to really dive into those more. For me and my husband, I think it's very much spiritual and experiential, and some emotional, and certainly emotional with the intellectual ones. And that's the slippery slope for us, where we can just end up in a debate where we kind of get angry at each other. So that's not, I'm going to say, well, we need to do fun things together, and we need to do connection things together, which I consider spiritual, over sitting down and let's talk about parenting philosophies. But every couple is different, and you might really connect on all four. What can we do together to spark that kind of intimacy? So we very much focus on this experiential and spiritual. What are your biggest fears related to returning to sexual activity? Laying those out. I'm scared it's going to hurt. I'm scared I'm not going to enjoy it. I'm scared I'm not going to be able to achieve orgasm. I'm scared I'm just always going to be too tired and I'm never going to feel like having sex ever again. I am scared there will always be a baby in our bed, and how the heck are we ever supposed to have sex? Like, whatever it is, lay those fears out. If partner doesn't know what they are, how can he help mitigate them? How can he help support you through those fears? So you got to lay these out. And what are you open to exploring in terms of sexual activity? And what are your no zones, especially for that initial return? Are you open to trying different positions? Are you open to engaging in sexual activity in a way that you have not before? So exploring new things and laying it all out on the table, in what you're okay with trying at that time and what you're not. And that is an important conversation to have as well. Okay, so for partners, kind of the flip. What do I do that helps you feel heard? How can I improve? What do I do that helps you feel calm? How can I improve? What do I do that helps you feel safe? And how can I improve? And I think it's good for partners to write down, actually, not just asking this question, but thinking about, what do you think you do that helps your partner, mom, feel heard? Not just asking her and having her tell you, because you might actually get kind of defensive, like, but I do that. I think it's important for dad to first share what he thinks he does that helps you feel heard. And you can be like, I had no idea you do that to help me feel heard. That doesn't work for me. Could you try this instead? And I think it starts off a much more productive conversation because you're understanding his perspective. And then you can say, well, actually, it doesn't work, or you can modify it, or go from there. What types of intimacy does he or she connect with? I think it's important for you both to be aware, because it may not coincide exactly. What forms of sexual activity are you open to beginning with? So is partner dead set on penetrative sex? It's good for you to know that, mom. Or is he open to other options for sexual activity? There's a lot more that can be done than is just penetrative sex. So exploring his preferences. And what romantic things have I done in the past that stand out to you most? I think this is a good one to filter on, because I kind of cues partners into like what works for you. And I asked a recent client of mine about this, and she was like, you know what I would really love is if my husband, he used to write these little, and this is why I put this little love note thing, he used to write me like little notes and bring me breakfast in bed. And he hasn't done that in a really long time, but that would really help me so much right now. And I was working with her in her early postpartum days. And I think he started doing it, and it did really help. So just exploring like things that were done before baby arrived that maybe dad could help with now, or help return to again. So those courting days, can you do a little bit more of that now? That would really help me feel more aroused. So some things to think about. Okay, so 10 ways to foster intimacy in postpartum. So these are things that can be done together, or are ways of communicating. So ogle your baby together. So when mom and dad look at baby, you're releasing oxytocin, and oxytocin is the love hormone, and that's helpful for arousal. So just cuddling baby and watching him fall asleep, and tucking him in the bassinet and having some intimate time could work. Remind your partner what helps you feel safe and calm. Maybe you had that conversation, but it's been a few weeks, and you're like, remember we talked about XYZ helps me feel safe and calm. Can you help me a little bit more with that? It's a big one that we have to revisit in my own relationship. So intimate touch, I mentioned this earlier, basic sensual touching of each other while avoiding easily aroused areas. Massage. This was a recommendation from another pelvic floor therapist that she gives her clients, which I was like, ooh, I love this. But adding a massage candle for a little extra. She recommends this Mod massage candle, but any massage candle can work. Taking 5 minutes to talk about your day while the other listens. So this is having this as a little routine in your day to help mom feel heard. And then dad gets heard too. So no phones, no interruptions, no questions. Mom just gets to say, here's what happened tonight. You wouldn't believe, blah, 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 blah. And she goes for 5 minutes, and then dad goes. So there's some good listening, not a lot of responding. This is about listening. And then after the timer goes off, you switch. And after that timer goes off, then it can flow organically from there. You can say, okay, time to sleep. Or, okay, let's turn on that candle, whatever it might be. But respecting time and each other. So giving that partner the floor for that 5 minutes and just sitting there and truly taking it in and listening. Okay, so for mom, wearing something different. So this isn't my recommendation, but it's one I see all the time. And like, I feel tentative about putting it on here, but it does help spice things up. So putting on a necklace or a fresh scent or something other than yoga pants, just like changing it up a little can help your partner's response can help you then feel more aroused, the response. So I know when I've done this, it's been helpful. Like the partner takes notice and then you're like, oh, that was worth a little extra effort and this is kind of nice and can be a good thing. Postpartum do get caught up in like wearing that same breastfeeding bra, nursing bra for days, and same yoga pants, and not doing our hair, and just like, oh, lipstick, and pop in some earrings, and that can be all it takes. Lighting a candle while your partner settles baby in bed. So this one's to the dad, like setting that environment that night when mom walks out of the room, like, oh my God, I'm so exhausted. And baby's down. She walks out and it's like, you've kind of neatened up and the candle's on, and she's like, okay. So, ideas. Schedule your intimate time into your baby's rhythm. So if you know baby pretty consistently takes a nap between noon and 1, well, on the weekend, try not to have plans between noon and 1. Try to be home, quiet hour, for you guys to just connect or engage in some sexual activity that can really help support moving forward into this postpartum stage. Let your partner hone their skills at settling baby while you unwind and do some self-care. So this requires mom feeling safe, heard, and calm. But then I think moms really need to put some trust into partner that they can step up and they can do some of these mom things so that you can do some of your woman things. Not forgetting that you're just a mom, forgetting that you're not just a mom, but also a woman. And it's great for you to take a shower or go for a walk or sit and eat a meal uninterrupted, or sit and just enjoy a cup of tea, or sit and watch like a 20-minute sitcom and laugh a little and just like do your own thing. Take care of you, the woman, while giving dad that